Hello, everybody. Welcome to the MMA podcast brought to you by the Institute of Clinical Excellence. My name is Annoushka Ranaraja. I'm a physical therapist and a member of the Modern Management of the Older Adult Division of the Institute of Clinical Excellence. Today, I'm going to talk to you about the use of high-intensity gait training to improve functional outcomes for patients with neurological conditions. We're going to talk about what high-intensity gait training is, why we care about high-intensity gait training, and who it is for, and then how to incorporate it. Gait training traditionally meant slow, careful walking, often focused on perfect symmetrical steps, with the therapist providing heavy manual support. But there's a revolution happening in neuro rehab, and it's moving really fast, literally. The core philosophy has shifted from perfect practice to intense practice. Research shows that in order to truly change how the brain works and improve walking speed, endurance, and quality, patients need to push their heart rates high and take thousands of steps per session. So, what is high intensity in physical therapy? High-intensity gait training is a therapeutic intervention designed to improve walking by keeping a patient's heart rate in a target zone, usually 70 to 85% of their max heart rate, or 15 to 17 on the Borg RPE scale for individuals who are difficulty reaching target heart rates due to medications. And this is all while performing functional task-specific walking exercises. Unlike traditional low intensity approaches, high intensity gait training is meant to be strenuous. The goal is to maximize the number of steps taken, often reaching around 1,500 steps or more per session, compared to a few hundred in conventional therapy. So, this might be about like 70% of your session, but hold because there'll be so many more improvements other than just in gait. Key components to this are one, intensity. So you want to monitor their heart rate or their RPE, and you want to make sure that that's staying elevated. Two is repetition. You have a high volume of steps, which helps with neuroplasticity, and which is the brain's ability to reorganize itself. And then three is specificity. Practicing walking rather than just doing strenuous strength exercises in bed or in chair is going to be way more beneficial to these patients. So the goal is to make walking almost subconscious again by creating a high energy demand that forces the brain to find the most efficient way to walk, tapping into that principle of neuroplasticity. So you might be wondering, if it's so intense, does it actually improve gait? The answer is yes. According to the APTA's clinical practice guidelines, high intensity walking is the strongest recommendation for improving walking function in neurological patients. And then the key benefits backed by research include that fasting walking speed. So patients often see a dramatic improvement in how fast they can walk, greater endurance so they can walk longer distances. It improves balance and quality by forcing the body to work hard. Symmetry and balance often improve just along for the ride, even if we aren't specifically training these balance exercises. Cardiovascular health improves because it acts like aerobic exercise. It lowers the risk of having a stroke or another stroke in most of these patients' cases, and it increases independence, which we love. More steps in therapy translates to more steps at home, which helps people get back to their everyday lives faster. So, what might a session look like? If your patient can carry on a casual, easy conversation while doing exercises, you're not working at high intensity gait training levels. These sessions should be rigorous. You want to carry a pulse ox to monitor heart rate in real time, or again, for some, you're just reassessing that RPE. But you want to monitor these things to really know that we're reaching that intense level that we need. We should not be able to have a conversation while they're doing exercises. Maybe that's what you say for the rest sessions because they are pushing so hard that they will need a little bit of time for rest. The typical activities we look at are treadmill training. So, this often includes body weight support treadmill training to make it safe, but walking at a high speed or an incline will help push your patient to that level that we need them to be. I understand not everyone has body weight support, so it's not always going to be for everyone. But we've found that treadmill training really does allow us to push the amount of steps that we're getting. So it's super helpful if you do have access to body weight support, or if you have a patient that is safe to work on the treadmill, just like clipping in with that safety button. But that's up to your discretion, obviously. Overground walking is another component of this. You want to make sure that you're walking fast on the ground. Perhaps you're adding obstacles like cones or stepping over hurdles, stepping over bean bags. There's a lot of different ways to make overground walking more intense and make it more difficult just for the patient to have to process as they're going through it. Adding resistance is another great way of doing this. You might add ankle weights, especially to their, if they are suffered a stroke, maybe to their paretic side. You could add a weighted vest to increase the effort required. I will sometimes strap a little medicine ball to my patient's gait belt and have them drag that along the way as they're walking. So, a lot of great ways to add resistance. And then you want to make sure these tasks are varied. So, we're not just focusing on walking forward. You want to make sure you're doing forward walking, backward walking, sideways. You're climbing stairs, climbing steps if it's just like a curve that they're going to have to negotiate. But all these varied tasks will help improve that much more. It's also important for us to note that this isn't just for your high level patients, high functioning patients. Even individuals with significant weakness can start high intensity gait training, often by starting at a lower intensity and then gradually progressing. Something that I would do with patients is I would go up to a certain speed, like when I had the treadmill and harness support, I'd go up to a certain speed, see how they do on that. And then I'm like, if I can have a conversation with them, I'm going to make sure that's my cue to bump them up in speed or in incline. But you want to make sure that you're monitoring those so that even our patients who are weak are getting pushed, but then especially the patients who are like higher functioning and still have a lot to go in terms of benefits. It's like make sure you're monitoring that as you're going through it. A common question that we get is how is high intensity gait training safe for people with neurological diseases, especially like people who have suffered strokes, people who have high blood pressure? High intensity gait training is actually very safe because as a therapist, you're going to monitor your patient's heart rate and vital signs. You're going to monitor how they're doing, what their response to these treatments are. I often will like read faces because sometimes if I just ask an RPE, my patient thinks that they are doing an insane workout, but they're maintaining a conversation with me. So I know that it's not that intense for them. We want to make sure that we're pushing to that intensity, but monitoring their heart rate, monitoring their vital signs to know that we're not pushing them too far. So that we know when they need a rest break, whether it be just to have like a sip of water and then restart, or if they actually need to bring their heart rate significantly down in order for us to be able to drive it back up and push into that intense range again. High intensity gait training is particularly effective for stroke survivors, individuals with brain injuries, and then incomplete spinal cord injuries. But honestly, I use these principles with most of my patients because most of them need gait to improve their gait speed. They need to improve their mechanics, they need to improve their balance and their strength. So it's like, why not use these principles that have proven to show that all of these things can improve with it? I don't spend 70% of my session often with my general population that I'm doing this with, but it is a big component that we focus on, whether or not I like verbalize it as high intensity gait training. Because I'm like, we do need to be able to walk over these obstacles. We do need to be able to do stairs. We do need to be able to go walk backwards or sideways. So we're going to incorporate all these things anyway. But definitely, especially effective for people who have suffered strokes, brain injuries, and then spinal cord injuries, incomplete spinal cord injuries. So, quick recap. High intensity gait training is changing the game in physical therapy by focusing on high repetition, high heart rates, and most importantly, high intensity. We are seeing better outcomes, faster recovery, and more people getting back into their community, which is what we want, right? We want these people getting back to their families, getting back to their friends, getting back into their church, their activities that they want to participate in, really improving saliency for them within their sessions because we're focusing their high intensity gait training on the things that they need to do in the community. If you have any questions, please reach out to me. But thank you so much for joining me today. If you're interested in learning more about interventions for patients, join us for a live course, which you can find on ptonice.com. Also, click the link below if you want to stay up to date on all things geriatrics. In less than 3 minutes, every other week, you're going to join our MMOI Digest email list, and that has research coming to you all the time. All right, thank you so much. Bye.